Hi, everyone, and welcome back to Arthritis at Home. Today, I'm joining you. My name is Ellen. I'm the Programs Coordinator at Arthritis Consumer Experts, and I'm joined by Elizabeth. Elizabeth is a physiotherapy student at the University of Toronto for her undergraduate thesis. So impressive, by the way. She completed an expert survey on equity considerations for osteoarthritis care with the end goal of translating that knowledge, which means taking it and actually implementing it into the real world. Welcome, Elizabeth. Thank you for joining us today.
Yeah, thank you so much for having me, Ellen.
Wonderful. So I actually got to see Elizabeth's presentation at the Canadian Arthritis Rheumatology Association conference and was fantastic. So I had to have her on here today. And as a fellow student, I want to ask you, how did you actually get involved in rheumatology? How did it all start?
Yeah, so I started to be interested in rheumatology when I completed a research co-op in Curtin University, which is actually in Perth, Australia. So it was really random. It kind of came out of left field for me. But we were researching barriers to implementing high value osteoarthritis care. And we were talking to all different kinds of health professionals, so physiotherapists, physicians, nurses, on what those barriers are to osteoarthritis care. And then from then on, I went to work with Cochrane Musculoskeletal Health and do my honors thesis with them.
Very, very cool. I love how you kind of threw yourself into that opportunity that you had, and it really resonated with you. So you kind of then went to seek out further opportunity in that area, which is wonderful. Could you share a little bit of an overview with that about your thesis work that you kind of had touched on with the Cochrane collaboration?
Yeah, so I think that's a really good point. It was kind of something that it was just an opportunity that came up, but the more that I started to learn about arthritis and all those different barriers, the more that I wanted to kind of parse that out a little bit. So I started working with both Cochrane Musculoskeletal Group and Cochrane and Campbell Equity Methods Group, because a lot of the barriers that had come up before were related to equity. So for this project, it's a little complicated, but I'll walk you through it. We compiled all of these different Cochrane systematic reviews that were on osteoarthritis. And then we took each of the interventions. So for example, using a brace or using exercise, and we got practitioners to rate them on how equitable they were. So meaning, is using this intervention going to disproportionately disadvantage certain communities, or is it going to actually help those communities and bridge that gap that's often there in care in osteoarthritis and other health conditions? So we had them rate all those interventions, and then we also had them provide descriptive comments. So what we found was a lot of these physicians and arthritis experts, they had put that in their practice, they found that conservative management, so using exercise, whether that be a home exercise plan or having people come into the clinic and do exercises with them, those were what they found the most useful for trying to bridge that gap, that equity gap, and kind of reach populations that often fall through the cracks. So yeah, that was kind of our summary of our findings. And then we also talked about the knowledge translation piece. One of the reasons that we were trying to kind of rate all of these different interventions was for a program called Evidence for Equity. And so we then want to translate it into a really easily understandable summary and post it on a website called Evidence for Equity, where we have all these different conditions, and then we have it easily accessible for clinicians.
Amazing. So we'll definitely link that below the video. I encourage everyone to check it out. And Elizabeth, this is my bad. I forgot to share with our audience. Cochrane is I want to say it's like an informal governing body for researchers now, but they produce, so it's run by researchers who really strongly believe in reporting guidelines and all being on the same page in, best evidence possible. So it's like researchers holding each other accountable. That's why offline, I was like, I had thought this was your master's thesis. So incredibly impressive work. And, I think for the audience, so if you're somebody living with a chronic condition or not, again, really interesting to see what Elizabeth has done in that space. And I think everyone, right, we're all patients at some point in our lives. So this work really applies to everyone.
Mhm.
Fantastic. Can I ask, so, you did this fantastic research and now you're in physiotherapy. So what got you interested in physiotherapy? And do you kind of see, that your past research knowledge really helping to guide where you're going?
Yeah, I think before this research, I actually hadn't really considered physiotherapy at all. So it definitely led me in that direction. It all of a sudden seemed like a really natural next step for me. But I think another reason that I was really led towards a position kind of in in a clinical area was just because, and I think probably a lot of like people listening to this with arthritis might listen to this research project and say, like those findings don't necessarily resonate with me. And it was because a lot of our data was coming from physicians and from health workers. And health workers have great information. They talk to a lot of different patients, but they also don't necessarily live with that condition themselves. And so I think that in my research, I was starting to really want to hear more patient voices and hear and really interact more with like the kind of on the ground community. And one way I could have taken that was to start doing more research with patients. And I have started to try and incorporate that into my research. But I also think that being in a provider role was something that I'd always thought about. So yeah, that's kind of the path that led me towards being in physiotherapy today.
And I'm sure it's going to serve you when you are a future clinician to have that always in the back of your head, right? I think that's so wonderful. I had actually gone the other route, so I went right into research. Elizabeth has become a clinician, so I think between all of the trainees, we will definitely cover the spectrum um, for our population.
Yeah, I think that like I really like the explanation you gave of Cochrane, because I think it's an organization that helps to like link those two routes as partners together, like researchers and clinicians, and then also patients really need to work as partners together or you just don't get anything done. So yeah.
I think what going off topic, but I think what I've heard, some of the leaders of the Cochrane collaboration, these are just researchers deciding to volunteer their time, by the way, they've described it as silos, right? Researchers are in silos. Healthcare providers are in silos, and then our patients are also left in silos. And what they've done, like you said, is bring everyone together at the same table and be like, okay, how do we improve care?
Yeah, exactly. And I think like there's still a lot of work that needs to be done in that area, but I think like having that as our vision and our end goal is really important.
Elizabeth, as a student, what do you think that institutions can do to promote equity, diversity, and inclusion? Right now you're currently at University of Toronto.
Yeah, so I think like I was starting to learn about equity and diversity and inclusion as a part of this research project. And in that case, it was trying to better inform clinicians and kind of have some sort of a pipeline of information to make clinicians more aware of the different equity considerations that they should be thinking of when they're considering a really specific intervention. But I think that the more that I've gotten involved in community initiatives, I've also become aware of the really powerful and important community organizing work that happens like in student bodies and in just like in all other community groups. And so I think that the biggest thing that those institutions can do is really listen to those voices and look really critically at the systems of power that are kind of at play in silencing those community voices. Because I think that's something that it's easy to kind of to say, oh, like we're going to listen, like it sounds really positive. But I think that looking critically at like systems of oppression, like I know that University of Toronto and just other institutions in Canada, including hospitals, are founded on and really have internalized principles of white supremacy, principles of colonialism. And so until you really name and then critically look at those institutions, then you're not going to, or those systems of oppression, you're not really going to be able to dismantle them. And I think we're lucky that universities and hospitals, they have a mission to support communities. And they say that, oh, we want to put health and education above profit. So we know that is like an amazing vision that these organizations have. But we just need to be listening to the communities on the ground and being held accountable so that in practice, that's what we're actually doing. So yeah, right now at the University of Toronto, I can give an example. There's a movement calling for an end to campus policing, to abolish the campus police. So students are really speaking up and letting the university know that the police don't make them feel safe on campus. And in order to have diverse, safe, non-harmful campus spaces for all individuals either living with arthritis or to go on to become healthcare practitioners, we need to kind of listen to those voices and create the community that we see.
The students, we should have a quote unquote healthy level of skepticism and self-reflection, right? Like that's what we can do. And as a student, where can I go if I'm interested? So say if I'm in an institution where perhaps not as proactive as University of Toronto, as you described, what if I want to do something about this, but I don't really know where to start or where to go? Do you know of any resources?
Yeah, I think it is difficult because a lot of them are really community specific. And I think some of the great, like the most powerful community organizing is often really location specific. So I just moved to Toronto 2 years ago, and I found that I had to kind of really put my ear to the ground to suss out like which groups I wanted to really throw my weight behind. Not to say that like this group is bad and this group is good. It's just like what's something that really resonates with you and what's something you really want to like get involved in. So like the first organization I was told of in Toronto was called Programs Toronto. It's a housing advocacy group. And housing is so unaffordable in Toronto that definitely really resonated with me. And so I think that it's kind of like keeping an ear out there to think like, like what are the systems of oppression that I see? And then kind of either Googling or asking friends, asking around, maybe asking like your equity representative. We have like an equity representative on our student council. If they know of these different groups that are going to be advocating for that kind of specific issue that you're seeing. And usually people will point you in the right direction. Usually I'm screaming in the corner being like, come over here. So yeah, and I think like students are so powerful. Like some of the most amazing movements have been led by students. So like, I just wanted to like really, I think that was one of my things that I really wanted to have as a takeaway coming onto this. Is this a podcast?
It will be turned into a podcast as well. Yeah. So it'll be on YouTube and it will be a podcast.
Awesome. Was just that like, I think a lot of students, sometimes they don't see themselves as like, oh, like I'm just have to follow what like faculty says. And like, I can't change anything. But like together, those student movements have been like so powerful. So yeah, I like in Toronto, the biggest ones I would name, if there's anyone from Toronto listening on here, that I've worked with here are Programs Toronto, Canadian Students for Sensible Drug Policy, Campman Support Network, although they've recently, I think, dispersed, but if they have kind of merged into other groups, Toronto Indigenous Harm Reduction. Yeah, those are just a few I can think off the top of my head. So hope that helps.
It does, because I think what you bring to the table or what you offered us is, all of us is like, where can we go read things? We're students, right? We think we're going to go read things and it's going to change our perspective and get us to take action. But that's not it. You're suggesting, look around you. There will be organizations that need your help. Go volunteer, and you'll see firsthand, right? Like you will see firsthand and you will understand firsthand where you are needed. And I think that's probably like the best advice I've ever heard about how to get involved. Just look around your own community. So thank you, Elizabeth. So practical.
Mhm. I hopefully, yeah, if anyone like needs help finding a group in their own like region, they can reach out to me because I have friends like all over. At least I have friends in a lot of places in Canada who are engaged in these movements. So yeah.
I think that's so wonderful. And we definitely, if anyone wants somebody to act as liaison, Elizabeth has kindly offered. So any students who are listening to this. But with that, anything else you would like us to take away today?
No, I think that's pretty good. I really appreciate you having me on. And it's also exciting to share about my research just because, you know, it's very niche. So sometimes people don't want to hear about your research. So I really appreciate it.
Absolutely. And I think our audience is absolutely thrilled to hear that, there are trainees and researchers and clinicians in training that are coming down the pipeline that really, really care and really are looking to do better, and maybe to I don't want to say improve the system, but maybe to shift the way in which we go about providing care just a little bit. So again, big round of applause. Thank you so much, Elizabeth, for your time. And yeah, I hope to have you on here maybe like a few years to see where you're at and how being a physiotherapist is.
Definitely. Yeah. Then I'll have a lot more practical experience for sure. So
All right. Thank you to everyone for tuning in. Have a great rest of your day. Bye, everyone.